Hi, I'm Dr. Tesh Amarasinghe, and this is
Dr. Erasha Dr. So it's really common for people to consult with their doctor because they're worried that they are excessively tired. Yeah,
That's true. That's something I see in my clinics as well. People come and they say, I've been feeling really tired for about 5 or 6 months usually, and then they reach a certain point where they think there must be something actually physically wrong with me.
Yeah. And actually sometimes that is the case. So there are some physical things that can cause you to feel particularly tired. And most people are quite aware of some of the possibilities that can be checked out through, for instance, blood tests.
Yeah, so a lot of people ask for a thyroid blood test or for their vitamin D level to be checked. That's very popular these days.
Or B12 or anemia levels, which are very common causes of fatigue, of tiredness.
That's true. But what I find quite a lot, and I don't know if that's the same for you, is that once the blood tests come back normal, patients just ask me to repeat the tests because they cannot believe that there is nothing organic causing their tiredness.
Yeah, I think that's fairly common, especially if they have historically had something that has been shown to cause their fatigue, and this time around it hasn't come up on the blood test. So,
yeah. So there are certain things you need to look out for if you are feeling tired all the time that might suggest something serious is underlying. For example, you might be losing weight, you might be having sweats at night, something else might be happening like a severe persistent pain somewhere in your body that's always there, especially night pain. And there are certain other symptoms which you can talk to your doctor about. But if you are given the all clear medically, then I think it's worth looking at some more internal factors of why you might be feeling tired.
sure, yeah. So there's loads of things that we do on a day-to-day basis that maybe are not helping ourselves.
I'd agree with that. Sometimes we're not sleeping enough, so going to bed too late or getting up too early, trying to fit loads into the day.
And that can seem really obvious, but actually it's quite easy to keep going through your day without actually realising how little sleep you are working on.
Sometimes you just need to have a bit of extra sleep.
Yeah.
Other things are alcohol. So people might not notice that they're having 1 or 2 glasses or more of wine or beer at night. And if you do that every single day, that's actually going to drain your body of energy.
Yeah, I mean, you're using energy to clear all that toxins out of your system, so it makes sense that you will feel more fatigued if you're having too much of that. And it's the same with caffeinated drinks.
I'm so guilty of this.
So I think a
So
lot
guilty.
of people who, particularly professionals or actually even people who are studying, who are relying upon energy drinks or caffeinated drinks to kind of get through their day rather than working on sleep. And it has the opposite effect, so it will maybe make you feel a bit better immediately.
Like
but
a peak, and then you're suddenly like sluggish.
Yeah.
So a couple of patients have come to me with persistent tiredness, and it turns out that they're drinking 6 or more cans of Coke a day, and that's going to make anyone tired over time. So we work on slowly withdrawing caffeine out of the diet, and sure enough, over the next couple of weeks and months, they start to feel more energy.
And the other thing is that when you feel really tired, it's quite natural to say you don't want to do very much. So it's quite normal, I think, for people to feel that they don't have the energy to go out and exercise, so they don't do that. And actually, it's a little bit of a cycle then, because if you exercise, you release feel-good hormones and it makes you feel generally good and more energetic.
Yeah.
But it's hard to kind of initially break through that and do that exercise in the first place.
Yeah, I did a video earlier on that about how exercising doesn't have to be something not fun. You can do something really simple like going out for a walk outside and just build yourself up gradually.
That made me think of something else to say that I've forgotten now.
One of the things that gives me energy, especially if I'm feeling a bit low generally, is to do silly things like have a little bit of fun. So
that's what I was thinking about.
Is it really?
Yeah.
Okay, so tell me more.
Well, I was thinking about the fact that actually mostly we all have jobs and other commitments that we have to do in a day, and that takes a large amount of our time up, and we don't make time for the things that we actually enjoy and find fun and are maybe not as important in the sense that they don't feel like they have to be done that day, but actually for your well-being generally, and again for your energy levels, it's so important to do the things that you maybe consider not as important but are actually really important for your health.
So what things are you talking about?
So hobbies, for instance. So for myself, it will be something like gardening, and for Tesh and I both, actually, heavy weightlifting, as you mentioned. Or
we
decorating,
obviously look stacked, yeah.
or decorating, things like that are maybe things that don't have to be done there and then, but are good for the soul.
Absolutely. And I think we both try to challenge ourselves by doing things that we think might not necessarily be that enjoyable, or we might find a little bit dull, but actually once we're doing it, it seems okay. So for example, we both went to a yoga class for the first time in years this morning.
Yes.
And it all seemed a bit surreal and not really us, but at the same time we came out of there feeling energized and ready to do it again. So
Yeah.
it's important to stimulate your brain, because you can't wake up thinking I'm going to feel energized and motivated. Not many people actually wake up feeling that way. It's a process. You've kind of got to have these goals and ideas and outcomes that you are aiming towards, and think, well, I want to make myself feel happy today, or I want to make myself feel energized. What can I do to do that? And then think about that. A lot of us get stuck in that, I'm so tired, I feel so low, I can't do anything. And it's nice to do that for a while and feel that way, but if you constantly do that without breaking it up, then you're going to get stuck in that pattern, and it's very difficult to get out of that.
And I think from what we've said already, it's quite obvious that your happiness and your energy levels are very closely linked.
Yeah.
Clearly there is a slight step if you are actually really clinically depressed, for instance, that can make you excessively fatigued, and clearly that is something that needs to be dealt with in a slightly different way to maybe some of the ways we've said, but also actually incorporating a lot of the ways we've said. So making sure you're doing something that is going to keep you active and doing things that you enjoy.
So I guess what you're saying is that if you have an underlying clinical illness like anxiety or depression, being active and doing exercise and having outcomes won't necessarily cure the underlying illness, but it definitely helps on top. But you still need to be seeking help from your doctor so that you can get that underlying problem sorted out, maybe with medication, counselling, or other routes as well.
Yes.
So that's good. We're on the same page. I hope your GP is also on the same page. I think it's always useful, you know, if you feel like you've got this issue, a lot of people go to their GP, get fed up with the answer they get, and then leave it at that and just get angry. But you might find that if you are not getting a solution to your problem or getting a proper discussion about it, you might just want to try seeing another doctor. That sometimes helps.
Yeah, I mean, I think like you say, it's quite normal to get angry about it because it comes from a place of frustration, and maybe you're just not on the same page as the doctor that you're seeing. And like you say, that there's always the option there to see somebody else, or just express that to the doctor that you're seeing, that you don't feel that they are understanding where you're coming from. Because actually a lot of the time their focus may be on trying to deal with ruling out scary medical problems, and they maybe need to be encouraged to see you and your life as a whole to figure out how to help you best. Yeah.
I know personally that sometimes I feel like I'm worried about patronising patients if I say, oh, everything's normal on your blood work and you're not showing any signs of cancer or other illness. So do you know what you should do is go out for a run. Like, I feel like I'm going to get slapped around the face quite a few times if I go around saying that.
Yeah, because I think, you know, a lot of people will only come to the GP when they think they've thought about everything that could be causing the problem. And you probably have to a degree, but there are certain things that, I mean, even for myself, I might say, I don't want to do exercise, or I don't want to concentrate on my sleep. I want somebody else to give me an answer that's going to be easier. And that's not always there.
Yeah, so I definitely want an easier answer. But as the years have gone by, I actually have had to just work on happiness and keeping energy up very actively. So I'm constantly looking up videos online of life coaching and trying different types of exercise and doing all sorts of things. I think I went through a spate of dance classes and all sorts just to try and keep energy and mood up. So it's not always the easiest process, but it's definitely worth it, I think, especially if you are in a place of being really frustrated. The other thing to note is if you think there really might be something going on with you and the initial tests were normal, but things are going downhill and you're starting to develop new symptoms that weren't originally there when you first saw your doctor, it is important to go back and just double check that everything is definitely okay. You don't want to miss something.
Yeah, and I think that's true of everything in medicine. Or your physical health, if you feel that something has changed since the last time you spoke to a doctor about it and that something has been persistent or significant, then yes, you absolutely should go back for another opinion.
Absolutely. Okay, well, I hope you enjoyed this video, and if you did, then I encourage you to share this with your friends and family by hitting the share button, and don't forget to subscribe to the YouTube channel at GP Helps. Bye.
Bye.